Good afternoon, everyone, and a very warm welcome. It's great to see so many of you joining us today. So this session has been organised to introduce and provide information about the University of Oxford's fully online postgraduate diploma in global health research, which is now running in its second year. My name is Kehkashan. I work at the Global Health Network, and I will be chairing this webinar for today. So before we begin, I'm just going to run through some basic housekeeping very quickly. Firstly, this session is being recorded. The recording will be shared in the coming weeks on the Global Health Network, so you can review and share with friends and colleagues. You will also be sent a follow-up email to guide you where to find these. Due to the number of participants, your cameras and mics have been disabled. So to interact with the panel, we ask you to use the Q&A function, which you can find in your toolbar. If you have any technical issues, please let us know in the chat box, and the Global Health Network team will aim to assist you as quickly as possible. And I just want to emphasize, we do encourage you to use the Q&A box. The panel will be answering any questions you post throughout the session. There is also an option to ask a question anonymously if you wish to use this feature. If you'd like to translate the speech into your chosen language, please find the closed captions function in your toolbar and select your language. And finally, in case we don't have time for all your questions in the Q&A section, we will save them and try to share written responses along with the recording, which will be shared in the coming weeks. So with the housekeeping out of the way, let's look at the agenda. As mentioned, this webinar has been organised to introduce the University of Oxford's fully online postgraduate diploma in global health research. This programme is designed for professionals like you who are looking to gain cutting-edge skills, advance their careers, and connect with a global network of experts in global health research, all while balancing work and life commitments. I'm delighted to be joined by course director, Dr. Elizabeth Allen, and she'll be providing us with a background of the course and an insight into how it will be taught and how it's been designed with a busy professional in mind. We will also hear from one of the course's highly regarded course teachers, Dr. Fernando Rubinstein, who will share his experiences about the course and teaching methods. And finally, we will hear from some of our wonderful alumni who will share their experiences and give you their insights about the course and how it has given them the opportunity to network with health research professionals from around the world, and how the course has helped their career development and opened doors to new opportunities. And of course, we will end with a Q&A session for our panelists to answer all your queries. Wonderful to see the number of registrants and their locations from around the world. A very big welcome to you all. And as we dive into today's session, I would just like you to think about how this programme can help you achieve your professional goals, whether you're looking to upskill, transition to a new role in research, or simply stay ahead in your field. This diploma offers the tools and support you need to succeed and transform your career online. So let's get started. Firstly, I'd like to welcome Dr. Elizabeth Allen, course director for the postgraduate diploma in global health research. Dr. Allen is a pharmacoepidemiologist and trials methodologist who has worked in clinical research for 30 years, mainly in Africa. She leads the diploma curriculum development and its organizational implementation. She also teaches, tutors, and ensures links with the wider global health network. A big welcome to you, Dr. Elizabeth Allen.
Thank you so much, Kehkashan, and thank you to everybody who's joining us. Really appreciate you taking time out on your busy day to join us from all over the world. It's amazing. Please keep introducing yourselves in the chat and thinking of questions as we go along. Okay, what I'm going to do, if I can have the next slide, please, is actually, before I get into the course, have a brief introduction to the University of Oxford, but then in terms of the course, what structure it has, what you're going to study each term if you choose to apply, how much, very importantly, how much time you need each week. It's a part-time course, but does need a substantial commitment, flexibility in terms of how the course is structured and delivered. Really importantly, the engagement with your classmates, tutors and teachers, the skills that you can expect to develop, support from the course team, but also the university more widely, and probably most important aspect in terms of costs, scholarships, and how to apply. Next slide, please. So the University of Oxford, I'm sure many of you have heard of the university. It's a world-leading centre of learning, teaching and research, and it's actually the oldest university in the English-speaking world. It first started around about the year 1096, can you believe? It's consistently ranked first in various university rankings, and for the Times Higher Education rankings, it's been first in the world for 9 consecutive years currently. It took on its first international student in the year 1190, and international students now make up almost 50% of the total student body. So this is around 12,000 students from more than 160 countries and territories. The university makes huge contributions to science and other fields, including, for instance, more recently, the Oxford AstraZeneca COVID-19 vaccine. This diploma sits within the Centre for Tropical Medicine and Global Health, which is within the Nuffield Department of Medicine and the Division of Medical Sciences. The Centre for Tropical Medicine and Global Health has various programs in the UK, but also extensively in Southeast Asia and Africa. The program, the diploma, also sits within the Global Health Network, which we've just achieved 1 million membership, and within its myriad knowledge communities, training and resources. Thank you. Next slide. So getting dug into the diploma, we feel it's a unique course. It's actually the University of Oxford's first award-bearing course, and it designed to be fully online. And we joke amongst ourselves that it only took over 1,000 years for this. It's actually pitched at the same level academically as a master's within the UK higher education qualifications framework. It is purely taught. It doesn't have a thesis or dissertation side to it. So it's a taught course in English over 14 months, which is 4 terms. And the teaching body and faculty is all experienced global research academics and professionals drawn from all around the world, reflecting, in fact, the student body. So particularly the Oxford overseas units that I mentioned before, but also the Global Health Network's many collaborators. So being fully online, there's no requirement to travel to Oxford. So this substantially reduces costs, of course, personal costs and for scholarships. But you can still enjoy the Oxford experience, but online. It's designed mainly for busy working professionals, where you can combine online study with your work, your personal commitments. And the contents is really covering the whole cycle of health research, from what exactly is health research through to, at the end of a study, converting that research into policy and practice. And the steps and processes required to conduct high quality and ethically framed studies, all within the context of resource limited settings. So the basic building blocks of doing research. And this is embedded uniquely within the large online and on-the-ground research community of the Global Health Network. Thank you. Next slide. The curriculum is actually based and reflects the WHO TDR Essential Research Skills curriculum, which is now published. And this was an evidence-based study itself that drew from over 7,000 global health researchers and stakeholders who participated in a Delphi study to select the topics that people would need to deliver an ethical and quality study, or the stages of a research cycle. And these research skills, the curriculum, now underpins a lot of the Global Health Network's outputs and offerings in terms of not just this diploma, but also its e-learning, knowledge areas and such like. Next slide, please. So getting down to the learning outcomes, the aim is that you would be able to design and implement a high quality ethical health research in a global setting, translate that research into, plan for translating that research into new policies, best practices, or perhaps new medicinal products, effectively manage the data throughout the life cycle, from capture to analysis and presentation, and practice research with consideration to its broader societal impact. Next slide, please. The course content, how it works is the 4 terms are each 8 weeks long, and 2 of those blocks, modules, run in parallel for each half of term. So each module is 4 weeks. So in term 1, which starts in October of this year, up until the end of the year, is concepts of health research, protocol design, ethics and community engagement. And then we move into term 2 in the January to March, which we dig down into more epidemiological concepts, such as study populations and interventions, not just in terms of what they are, but how to implement, for instance, selecting a population, recruitment and retention, that kind of thing. We then delve into data capture and analysis through different data capture tools and considerations and quality issues, and into data management and data sharing, which is now a requirement for most health research. Term 3, which is the April to June of 2026 in this case, is all things sort of broadly quality, so quality assurance, governance and oversight, but also some allied topics in terms of safety and pharmacovigilance, and how to set up a research laboratory, a good quality research laboratory, and the importance of diagnostics in global health. Term 4, which would be mirroring the date of term 1, so that would be October to December next year, and it's quite unique, I think, to include this in these kinds of qualifications, things such as project and financial management, leadership and communication skills, whether that's to the public or other researchers, or maybe even journalists, for instance, and reporting, whether that's to different stakeholders, or publishing your report, or presenting at a conference, and then converting that research into policy and practice. Next slide, please. So the structure is we start off each week, each lesson has a week cycle of a pre-recorded lesson. The teachers set real-world tasks, which are done online on the learning platform. We then follow a week later with the live class for interaction, discussion with the teacher and class. In amongst this, there's various tutoring. If you carry on to the next slide, I'll come across that a little bit now. So that's just a snapshot of the learning platform that Oxford uses, which is Canvas. Some of you may be used to that, where we store all our resources. Next slide, please. And you would have access to library lists, which are drawn a lot from the university's libraries online, which is actually 100 libraries, over 1 million ebooks, over 100,000 electronic journals and databases. Next slide, please. Assessment is, there's an assessment every term. It's in 2 parts. It's the same every term. It's a group project culminating in a group presentation of practical real-world tasks during the term, plus an individual essay. And these are supported by the weekly tasks that the teachers set and reflections during the lessons themselves. The group work is guided by a tutor to help facilitate different time zones and all sorts of practical issues like that. And the individual work is guided by a one-to-one personal tutor who is a senior staff member from within the university or the Global Health Network. Next slide, please. So all in all, aside from the academic outputs, there's a lot of things going on that will help develop transferable skills in terms of time management, planning and organization, whether of a group task, academic writing skills for essays, report writing, communication, etc. Next slide, please. And the support is multi-level. So from the academic and administration team, through formative feedback during the, as the group assessments are being developed by teams, through the multiple layers of tutors, also within the class itself, through peer-to-peer support, There's a class rep who will represent you as a class every year with the university, and a host of other skills building resources through the university, which we'll explain later. Next slide, please. So what do you need to do to apply? You need to have a relevant degree. So it could be a health professional degree, a basic science degree, something in global health or public health, equivalent to a UK first class or upper second class undergrad degree. You can also have a postgrad degree as well. There's guidance on the application's website on what that means, what is the equivalent of a degree outside of the UK to that. And if you don't have a degree, don't despair. There is still a possibility of being successfully offered a place on the course. If you have a strong relevant work experience that equates to that, and we also give guidance on the admissions portal of how you can substantiate that in your application. Next slide, please. So you can apply now, right now. The deadline, just jumping to the second to last bullet, is application portal is open at the moment. It's rolling. We will continue offering places until we've reached capacity. We anticipate that around late April, early May, but we will give a 1-week notice on the admission site. So it's the end of February. I would suggest you getting applications in the next month. There's an application fee of £75, but this is waived in quite a few circumstances, including quite a lot of countries in low resource settings. So you'll see that on the application site. You'll need the usual things, a CV, a personal statement, some references, and your transcript, and to demonstrate English language proficiency, all guidance there. We don't need a research proposal because there's no research project as part of this course. We would then select shortlist candidates for interviews, and the course fee currently £15,000 for the 14 months, and that includes everything. There's no additional costs for books or travel or anything like that. But I understand that is difficult. We all understand it's difficult to fund this kind of course. So on the next slide, please. We do work really hard to find fully funded scholarships for this diploma. It's a new diploma, so we're still building up that evidence base with potential funders. This year, we have had funding every year from the Africa Oxford Initiative. For those from Africa, we have further funding for that this year. You will be automatically considered if you're offered a place on the course. And if you're shortlisted, you'll be invited to attend another interview with the funder. But because scholarships are limited, we encourage you to explore scholarships and bursaries for your country and or region. And please speak to your employer as well to see if they would be willing to contribute to fees. Okay, next slide, please. I'm going to try and hurry up here. So previous students, this is what a student body looks like. We have, really broad studentship from clinicians, nurses, basic scientists, public health professionals, ethicists, and others, covering a broad range of interests in health and health research, and from across the world, Africa, Asia, and Caribbean, and with a really good gender balance. So you're going to hear from some of them and a teacher next. In fact, I'm going to hand over to Dr. Rubinstein now. Thank you very much.
Well, hello, everyone, and I'm also delighted to be here with all of you, interested in this great program that really offers a great variety of knowledge in terms not only of theory, but also in practical implementation and application of those skills that you'll be acquiring throughout the course. The main thing I was asked to talk about is my experience teaching as one of the teachers and the many teachers in this course, and my preferred things that I will talk about is how to interact with you as students. As Dr. Allen said, we have a variety, a diversity of studentship with different experiences, different backgrounds, bringing to the discussions, to the live discussions that we have, great richness in every topic that we talk about, based on their own experience, based on your own experience, based on our experiences that we can exchange throughout the live sessions. So the structure for each one of the materials that you'll be showing on the Canvas platform is for every week, for every lesson, you'll have a recorded lesson that one of the teachers will be recording a week prior to the live lesson. So you'll be attending that at your own pace, whenever you want, every time you want, and all the times you want to repeat that recorded lesson for the different topics that are covered in the program. So after that, you are attending the recorded lesson, you'll have some tasks, some either quiz, some multiple choice, or some specific scenarios with case studies and real life examples that you'll be asked to solve, to resolve, to offer your own interpretation to the different scenarios that are presented to you. The other thing that is important for all the students to be able to use is a forum in the platform that you can pose your questions or your opinions, and we can usually have a good discussion about the different topics in the forum before the live session. And at the end, each of the recorded sessions will have a following week following the recording, you'll have a live session. And that live session gives us the opportunity to have at least an hour or an hour a little bit more of time to discuss live with the teacher about all your questions, all your points that have not been very clear from the recording, or the different reinforcing the main key topics that have been discussed during the recording and during the exercises or the tasks. One of the things that it's important is that those live sessions should be really interactive. That's the richness of a live session. The live sessions are not intended to repeat a lecture, are clearly intended to discuss particularly hard points, key points, difficult questions, or going back and forth through the tasks or through the exercises to be very, very sure that to ensure ourselves and yourselves that you've really acquired and understood the key points that have been covered by the different lectures. So this is important, that also you will have some other additional material throughout the reading material, mandatory reading material, recommended reading material on the different topics. And the thing is, if you can really enjoy this about not only attending the recorded lesson, reading the material, and completing the tasks, you will be able to really harness the live session and all the discussion, the ping pong discussion that we will have on every different topics. And that's a real good way of harnessing what the teachers have to offer based on their own experiences, and you will have the opportunity to interact with very good researchers and teachers with a diversity of experiences in global health. Thank you.
Thank you, Dr. Rubinstein. It's always good to hear from teachers to gain a better understanding of how a course will be presented. And I know the current students and alumni will agree your lectures are very thought-provoking with plenty of discussions to be had. So absolutely wonderful to hear from you. And on that note, I think we should start listening to some of our alumni. So we will now hear from the first cohort, and I will hand over to Dr. Frangelo, Conrad, Tampus, Godwin, Pius, Ohemu, and Dr. Ethel, Kamuti. Welcome, everyone.
Hello, everyone. Good morning, good afternoon, and good evening. I am Frangelo Tampus, a pediatrician and an early career researcher from the Philippines. And I'm a member of the first cohort of the PGDIP in Global Health Research. And my classmates and I are here to share some of our experiences to help you decide if this program is the right fit for you. So one of the main reasons for my main reason for choosing this program was the exceptional partnership between the University of Oxford and the Global Health Network. Having experienced the wealth of resources the Global Health Network offers through their free courses, I knew they were committed to building research capacity, and combining this with Oxford's unparalleled reputation, I was confident I'd receive an outstanding education. But it's not just about the prestige, but it's the quality of learning and the opportunities it unlocks. The PGDIP experience in Oxford goes far beyond the excellent curriculum. As a student, you gain access to an incredible range of resources, including the Bodleian libraries, which Liz introduced earlier. So imagine having access to a vast collection of academic journals, databases, and special collections to fuel your researchers. The librarians are incredibly helpful as well. Personally, they even assisted me in refining a systematic review literature search, which I was doing for my work. Plus, Oxford offers other numerous free online courses, engaging talks by leading experts, and stimulating conferences across many disciplines. You get to pick what fit your interests. So these opportunities broaden your knowledge beyond global health and connect you with a vibrant scholarly community. My personal favorites are the series of lectures on conducting and synthesizing qualitative studies, lecturing big groups and classes, and also the fundamentals of statistical softwares and analysis. Aside from this, the university also supports its students by providing access to full versions of different softwares, including NVivo, SPSS, EndNote, and Covidence, just to name a few. So these are very helpful if your current work also involves research. And of course, no Oxford experience is complete without mentioning the exceptional faculty. So the professors aren't just academics, they're leaders in their fields, and they bring a wealth of real-world experience and a true passion to their teaching. They share invaluable practical knowledge, cutting-edge research insights, and personal recommendations, so enriching the learning experience. The opportunity to learn from these individuals and participate in thought-provoking discussions and to receive personalized guidance is truly transformative. And their expertise and mentorship will undoubtedly shape your academic journey and career in global health research. The course is more than just a qualification, and as I mentioned, it's really transformative, and it's a chance to join a global network of researchers, contribute to impactful work, and make a real difference. So I really encourage you to consider it, and I wish you all the best as you explore this opportunity. And I'll hand it over to my colleague who has achieved much also during our time in the course. He'll share more about the course and his networking experience. So everyone, I give you Godwin, Pius, Ohemu.
All right. Hi, everyone. My name is Ohemu Godwin Pius. I'm a Nigerian and a recent graduate of the Postgraduate Diploma in Global Health Research from the University of Oxford. So very briefly, I'm going to share with you the benefits of the Postgraduate Diploma program. And of course, there are lots of benefits from this program, but I'm just going to share my thought on four fundamental benefits of the Postgraduate Diploma in Global Health Research. So number one, the first benefit, which was very outstanding for me, is that 14 months is 14 months. In other words, the program actually came across to me as very straightforward and very efficient. We started in 2023. 2023 October, and then we ended in 2024, and that was it. So there was no delay, no lag, no cancellation. So if you are class of 2025, you already know that you are going to graduate in 2025, and that was a big draw for me. The second benefit that I would like to talk about, Louis, is that your degree certificate actually comes in both soft and hard copies. You get your degree, your transcript as soft copies via a platform called the e-document platform owned by the University of Oxford. From that particular platform, you can actually share your academic transcript with institutions in different countries of the world. You can add them up to the platform as third parties for them to view your transcript and to consider it for any opportunity that you are applying for. And then for those of us who are from LMIC, or of course from any region of the world, you might want to send your transcript to WES for evaluation instead of paying additional fees for WES to evaluate, or for your transcript to arrive at WES. You can just add WES as a third party on your e-document portal, and WES will actually have the right to come in there and access your document, and it is owned by Oxford, so it is trustworthy. And then finally you get the hard copies of your transcript, the paper printed copies of it, which you can actually use, for on-site application and all of that. Then number 3 is that your degree is at level 7 of the UK framework for higher education qualification, and it provides access to a level 8 program. Now, what this means is that your degree is considered the same level with a master's degree program. So you have a postgraduate diploma in global health research. You are at the same level with somebody who has a master of science, either in epidemiology or in any course of his or her choice. So you are at the same level. And just as a master's degree grants you access to a PhD, likewise the PGD program also grants you access to level 8 program, which could be a PhD as well. Then finally, which is a big one for me, is the fact that the postgraduate diploma actually enables you to enjoy the Oxford effect. And the Oxford effect for me actually cut across 3 major areas, and I will just walk through these 3 areas quickly. Number 1 is that you become an alumnus of the #1 university in the world. It means a lot for me, actually, that you are added to a community, or you are part of the community of students, of scholars of the #1 university all over the world. I think it's a big one for me. Then number 2 is that while you're on the course, you get an Oxford email account. And this is not just an email account, because it helps you to unlock access to premium academic content, research papers, publications from from high impact factor journals. With your Oxford email address, you can actually access this wonderful content, and you can use it for your research and for other engagement that you might be involved in. And then finally, being a part of the postgraduate diploma actually connect you with the Global Health Network, a research community of over 1 million members that are enabling research in different settings all over the world. So I feel these 4 points that I have listed, they meant a whole lot to me. I enjoyed my time on the course, and I hope that when you come on board, you will also enjoy your time on the course and learn, network, connect, unlearn, and relearn. I'll now pass on the baton to my colleague, Dr. Ethel Kamuti, for her to share her experience as well. Thank you so much.
Thank you so much, Pius. Good morning, good afternoon, and good evening, everybody. My name is Dr. Ethel Kamuti, and I'm a medical doctor currently based at the Center for Infectious Disease Research in Zambia, where I work as a clinical research fellow. I've had more than 5 years' experience in clinical trials whilst working at CIDES, but never really had an opportunity to do a course like this one and obtain some academic qualification that would support my career in research. So that's one of the reasons why I applied for the course. And of course, it was also to improve the standards of how we conduct our research, and I've been able to achieve that. So I'm happy to share with you how this course has transformed my career with some practical examples. And the first one being, of course, the transferable skills that I gained from the course. So these have helped me to learn how to work with new team dynamics, because most of my classmates were actually from different cultural setups, different geographical setups, and we had different levels of exposure professionally. And apart from the course content, we're able to learn from each other and teach each other technical skills as we prepared for our assignments and presentations. And some of those skills, what I'm using currently to accomplish some of the tasks I have for my projects. The biggest opportunity I'm happy about is the one we had to set up the Global Health Network in Zambia. And this was done through a memorandum of understanding that was signed with the university and the Center for Infectious Disease Research in Zambia. And our goal is to expand global health research activities in Zambia. So through TGHN, we've been able to participate actively in some submissions, the first one being a consortium submission, the Malaria Vaccine Safety Monitoring Readiness and Implementation Consortium, which had about 10 countries participate. And even though we didn't get that grant, we still have an ongoing consortium and are able to look for other grants where we could just see how we can advance malaria vaccine research. Another opportunity we had with the Global Health Network as an organization was to host an AFOX fellow last year in December, who has objectives to meet under the MESH project. Also, we've had an opportunity to discover what we call the International Severe Acute Respiratory and Emerging Infection Disease Consortium, ISERIC, which we've applied to as an organization and responded to a call on the clinical characterization protocol, and we're waiting for feedback on that. So it's opened opportunities even for the organization to expand research in Zambia. And personally, it's enabled me to develop professionally through the interactions with the tutors on the course. I was made aware of opportunities that were relevant to my career growth. And the one I'm proud about is the Society of Clinical Trials. There was an award that was shared, and I applied for it. And I have actually been accepted to receive the Equity, Diversity, and Inclusion Early Career Award at the Society Clinical Trial meeting that's set for May this year. And of course, that means that professionally, I've gained value even to the institution. And that's the direct benefits that come with that. I've been asked to lead more projects. I've been asked to oversee more projects, and including overseeing staff at site level and activities at site level, which I'm excited about. And generally also, I've been included in grant applications that are being set out for the organization. Yeah, so just to encourage everybody that there's more that comes to the courses according to what your interests are, and the tutors do come in helping you identify how you can grow. Thank you. That's all for me.
Wonderful. Thank you to you all for sharing your experiences. I'm sure the guests here today have received a very good picture of what they can expect from the course and how it can help progress your career. And also a big congratulations to you all on completing the course. And for our guests, you can learn more about our cohort and their learning journey on the Postgraduate Diploma page on the Global Health Training Centre. Also, quickly, I realised earlier we didn't get a chance to introduce Dr. Rubinstein, who is a lecturer on the Postgraduate Diploma. Dr. Rubinstein is a primary care physician and epidemiologist from Argentina with a long-standing experience in research and teaching and applied research methods for public health. He's a senior researcher at the Institute of Clinical Effectiveness in Argentina and adjunct professor of public health at the University of Buenos Aires. And since October 2023, he is the training lead at the Teaching, Training and Professional Development Centre of the Global Health Network at the University of Oxford. So I hope the information received so far is helping you all make up your mind about registering for the University of Oxford's first fully online postgraduate diploma in global health research. We will now move on to the next part of our programme. The Global Health Network team has been working hard to answer your queries and also collate questions for us. So a big thank you to Louis, our workshops and webinars coordinator, and Lauren Welland, who is the course coordinator for the postgraduate diploma, and she will be your support for when you enrol on the course. So big thank you, Lauren, as well. So let's open to questions. And Liz, if I can hand over to you.
Okay, Lauren's going to help me with this on a double act, but the first thing I want to is go back to the funding issue, because I think that's a lot of questions and scholarships. So just to reiterate, it's a new program. We are building relationships with funders, collaborators with the Global Health Network, who are really keen to support. But obviously this takes time and is a moving target. And, it's a difficult funding environment at the moment globally, particularly for capacity development and education. But with that said, currently for this application cycle, which is to start in October of this year, we have some fully funded scholarships generously available from the Africa Oxford Initiative, who have funded scholars in the previous 2 years. And those of you from Africa who are applying and are offered a course, so you will go through the whole application, you hopefully will be shortlisted, invited for interview, and then offered a place on the course. You do not have to do anything else. We will automatically consider your application for the scholarship together with the funder. So you would go through another cycle of review, shortlisting, and then the funder will select those with offers from Africa to come for an interview, and hopefully you would be awarded one of those scholarships. Currently, we do not have within the diploma scholarships available outside of that. So that's why I said in the presentation that if you could be on the side, looking for scholarships that are available within your region. I know places like India often have like scholarship portals with big industry and whatever. So have a look, and we can try and point others your way. And also a big important, and several of our students in the first 2 cohorts have been supported by their institution. So this is up to you to make a case. We can provide you with information about the course if you'd like to help make that case. If you're working across multiple projects, maybe you could tap into different funds from the different projects. So try and make a case for your employer as well to support you, and we'll do all that we can, and we hope to increase the number of scholarships in years to come. Thank you.
Thank you, Liz. So I think that answers quite a lot of the questions that have been asked, but one other one is, when will the admissions page close for the intake for 2025?
Yeah, so it's on a rolling basis at the moment, and it depends on the capacity of the course, but we do have quite a big capacity of the course. We can take anywhere from 20 to 70 applicants this year. So, however, we do get a lot of applications, and a lot of offers are given out as well. I anticipate that we will close the admissions towards the end of April, beginning of May. But as it says on the admissions page, keep an eye on that page. We will post a week's notice. But as I mentioned, it's the end of February. I would suggest you try and get your application in March, get your documents together and make that application by the end of March. But we will likely keep it open a little while longer as well.
Thank you, Liz. And another question, how is the graduation for the course conducted?
Yeah, that's an interesting one. Thank you. So currently, because the course is fully online, because for equity reasons, we want this course to be available to anywhere in the world, and not have to think about the costs involved in coming to Oxford. And also, of those who could afford to come to the Oxford for a graduation, and the others who couldn't, we want to have a level playing field there. So there is no on-site on the ground graduation at Oxford. I realise this is quite disappointing for some people, but it's something that we're working on with the alumni, actually, to have discussions about how we can make that meaningful. So watch this space about that. Thank you.
Thank you. So this is an interesting question, and this would either be for you or Dr. Rubinstein. What makes an applicant stand out?
Very interesting. Yes. So once you've achieved so I'll speak and then maybe Fernando can speak. Once you've achieved the basic sort of eligibility criteria in terms of either a degree or experiential experience in health or health research, your CV actually is transferred onto a template on the portal. So obviously we want that to be as comprehensive as possible. There's sections there for particularly any publications that you've been involved in or other courses that you've done that relate particularly to health research or relevant otherwise. So make sure you fill all those blocks in on the template. But a lot of it comes down to obviously a personal statement. We want to see what you're hoping to gain from this course, and also how perhaps you could pass that on to others within your own network, within your own institution. So I would say that once you've met the basic criteria and you've got a good quality application with no missing bits, then you are likely to have an offer. But I think in terms of a scholarship, that's where perhaps that comes in, and then being really prepared for interviews. Okay, Fernando, would you like to jump in there as part of the...
Just to complement just a little bit of what you just said, was very clear. I think that one thing that really makes an applicant stand out is a letter of intent, having a clear idea of what you want to do with the knowledge that you will be acquiring, how you will apply it, how you will implement, what's your career for the next few years after acquiring your skills throughout the course. And also, it's important to not forget about the interview, because if you are shortlisted for an interview, in the interview, in addition to your opportunity of making clear your points of what you're going to be doing with that and why you're so interested in having this and participating in this course as a student, is an opportunity for you to clearly convey your message and your message about what you're going to be doing, what's your career in terms of global research, what's your work, what's your context in which you will be applying all the skills is really, really important.
I would also just add two other things. We don't particularly like applications that come in where they refer to another course. We understand this happens, that people apply for multiple courses at once, but please look it over very carefully, that the cover letter speaks to this course. And for the interview, just to give you a sneak, I mean, we really want to know that you've looked at the course content. There's plenty of information on the website links that we've given. So, we want to know that you've read that and know what you're letting yourself in for.
Thanks, Liz. I just wondered if you could go back over how the course is run part-time and the expectation of doing this whilst you're also working. Please.
That's really important. I mean, it's a blessing and also a challenge, when you're working, and you bring such a wealth of experience with you and dynamism and to the peers and to the teachers, and it becomes very important to have that cross-pollination with studying and working. And a lot of our students can put their what they're learning straight into practice if they're working, for instance, in a research institution, almost live. We've got one student this year who's almost like doing the lessons and then putting it into practice straight away, writing a protocol, for instance. But that it is quite intensive. We would say you need to allocate up to 20 hours per week. So it's quite flexible in that there's only 1 hour synchronous live lesson for each of 2 lessons per week. So there's only 2 hours when you need to be online at the same time for a live lesson, aside from some group work. So the rest can be done in the evenings, weekends, you know, looking at recordings and readings, but it needs to be done. And it really adds value to the whole course to interact and do the tasks and the readings, and that can take up to 20 hours a week.
Thank you, Liz. Would you also be able to talk about the requirements for the higher English language requirement for the course, please?
Ooh, I haven't got them in front of me, which is not good. I think it's the IELTS 7. Don't quote me on that, and we can put the link in the chat to the admissions page. But there is a way that you can apply for a waiver from that. So if you're undergrad, or even some people come in to apply with a postgrad, then yeah, and I might ask one of the alumni to speak to this if they've had to go through it themselves recently. Then you can apply for a waiver if you get a letter or some kind of documentation from your Institute of Learning that you that course was in English. And we do that a lot. I mean, there's a lot of applicants who get that waiver, so it's quite common. Don't know if it's Frangelo is nodding. Are you able to add anything there?
Yeah, based on my experience, I actually just provided proof that the primary mode of teaching in my courses were English. So I didn't need to take the IELTS exam anymore.
Perfect. Thank you.
Yeah, Liz, that was same for me too. I had to approach my university here in Nigeria and then to get a letter from the Senate or from the Office of the Registrar confirming that my 5 years of study at my undergraduate level were taught in English, and that served for the purpose of an IELTS. So I didn't have to enroll for the IELTS exam. Thank you.
We look at all those cases individually. So I'm involved in obviously that and signing these off, but there's other types of situations. If you haven't had recent study, but you're working in projects that is predominantly in English, you know, global projects with, I don't know, UK or US or whatever, where the, you know, the project is in English, even if the home language is not, then we will also look at those cases and work with you to understand the situation.
Also, one thing is, remember that the interview will be run in English. So that's another opportunity that all of us have to talk to you, and the way you express your ideas and the way you can follow the interview is also important, in addition to the certifications that might be requested.
There was something, maybe I could jump in, Lauren. There was a couple of questions about having applied before and not having ultimately getting onto the course for whatever reason. So I think if you applied for the course and you were not given an offer based on your eligibility and nothing has changed in the meantime, you are not likely to, you know, to be successful this time. However, unless you can produce more evidence of, for instance, your work environment and how it lends itself to the experience required. Those who, and that's quite unusual actually, because the eligibility criteria are quite clear on the website. Those who were interviewed for scholarships previously, I'll need to double check whether you know, you would be eligible to be interviewed by the funder. So we will find that and post that after this webinar.
Hi, Liz. So we've got a question about an English waiver. If you are from an English-speaking country and attend a university, do you still require a waiver? So,
ooh, I wish I'd read the finer details of this. I don't think so. But I would have to check, because I think each country might be you know, looked at in its own right. So we're going to post the recording of this and the slides on the Global Health Network, and we'll mop up any questions that were outstanding so that we can give you the correct information on that.
Thank you.
And you're also very welcome to email us. I'm presuming the email has gone, the PG dip, as we call it, email, has gone into the chat, and maybe we can finish off with that as well. For any remaining queries, please just drop us an email. I can look at, you know, your CV, your qualifications, your situation with English language, and we can do a more personalized response.
I'm just scanning through them. Is there any that jump out at anyone else that you think will be good to ask?
Godwin, you want to jump in to answer a question?
Well, Liz, there's no question in particular for me, but my advice for participants who are desiring to enroll for the course is that as fast as you can, please hurry up and take advantage of it. For my participant from Nigeria, I saw the chat and we have a lot of people expressing interest for it. It is an Oxford postgraduate degree. It has a lot of value. It will be greatly beneficial to you, and you can approach your university senate and get a proof that your course was taught in English language, and that will save you the cost of going to write the IELTS exam again. So I am a beneficiary, and it is good. It is very, very beneficial, and I'll be very happy to have more Nigerians and more citizens of the world on the course as well. Thank you so much.
Okay, I think we're almost on the hour, so I'm going to hand back to Kehkashan, and don't worry, we'll address any outstanding queries afterwards.
Wonderful. It was great Q&A session there. I think a lot's been learnt in that last 25 minutes, I think. So as we come to the end of today's session, let's take a moment to reflect on what's been discussed. This postgraduate diploma is designed to enhance your knowledge and raise the standards of professionals working in health research within a global context. So whether you're from an organization that funds, sponsors, or regulates research, or you're working at sites and centers where research is conducted with study participants, this program is tailored to help you lead successful and high quality research studies. So if you're ready to take the next step in your career and make a meaningful impact in global health research, we do encourage you to visit the University of Oxford website to register for the programme as soon as possible. We've received so many comments and questions which have been answered diligently by the panel, but any outstanding questions, we will ask our panel to respond to these in writing, and they'll be available for you in the coming weeks. The recording of this session, along with any additional materials, will be shared with you via email and on the Global Health Network. And finally, a very big thank you to the panelists and to you, our guests, for attending today. And I hopefully we've convinced you to enroll on this innovative, fully online course from the University of Oxford. All links to the applications page and further information have been shared now on the screen and in the chat box. Once again, a very big thank you, and we will now close this session.